So let's make the great beginning, doctor. Give your honest answers. Looping pattern during the growing period of the bone. Which arteries? Typically they are metaphyseal arteries, not epiphyseal, is what you need to basically remember. Sternoclavicular. One type of joint is a standard MCQ in the exam, doctor. You have to be quite sure. So, saddle type of a joint. You must know which are plain joints, saddle joints, hinge joints, pivot joints, ellipsoid joints. The different types of joints and the type of joint. You will remember me in the tomorrow's exam. Definitely one question is going to come. Which nerve passes through peroneata teres?
Median.
We were all fresh in anatomy. Our aprons are recently stitched when we were dissecting the cubital fossa, if you remember. So, median nerve is what you need to remember, typically pierces through the peroneata teres. Facial nerve supplies all these except very standard question. Sing along the answer, doctor, so that the students all the way from Gulbarga and all the way from places like Latur, so many new centers we are going to have like this, who are attending a live, interactive, online, everyday classroom with some of the best teachers across the country reaching their desktop. So, doctor, anterior belly of digastric, if you take, it is derived from the first pharyngeal arch. That's the reason the mylohyoid branch of the inferior alveolar nerve, which is the branch of the mandibular division, is the one which supplies the anterior belly, whereas posterior belly is from the second pharyngeal arch. Second pharyngeal arch's nerve is seventh cranial nerve, is what you have to basically remember. Now, jugular foramen say facial nerve doesn't pass through. So, you must know the contents of the jugular foramen, doctor. You are having the emissary veins, then you are also having glossopharyngeal, vagus, accessory nerve, meningeal branch of the ascending pharyngeal artery, inferior petrosal nerve and meningeal branch of the occipital artery. All these foraminal contents is the favorite spicy issue for examiner. Foramen ovale. What passes through foramen ovale, doctor? Male. That is long time back I revised it. I forgot the contents. Knowledge is like that. Only until entrance you will remember a few things. After that you will forget. Then rotamax. Foramen rotundum is maxillary nerve. Is what need to be remembered. Now, cerebral blood flow. What is accept about it? A. Very good. Ramakrishna sonorous voice with all that androgenic bass is very popular across the Indian subcontinent. Students were asking Ramakrishna what is he going to answer today. So please, Nafis is also very popular across country. Students say very good. 1-to-1 head-on collision to the sir, only Nafis can give. So they will all be missing Nafis from March 2nd because she will be among our topper list. I am very confident. What do you say, doctor? Inshallah. So that's the point. So it is the grey matter, doctor, which will be thinking in our brain. White matter will be watching while the grey matter is thinking.
Sir,
so,
why not D, sir? D.
Why not D?
It is auto-regulation, so it doesn't depend on perfusion pressure.
It is dependent on the effective perfusion pressure. And that's what now, suppose if your blood pressure is low, though auto-regulation is there. If the blood pressure is low, then that definitely has an impact on the cerebral perfusion pressure. That's the reason people go into a state of, for example, carotid. Atherosclerosis is there.
That is in extremes, no sir, not in the normal range.
But definitely it is dependent on the perfusion pressure, no, ultimately. Though there is an auto-regulatory mechanism available. which regulates the perfusion pressure ultimately. That's the point. Then at rest, the brain receives what percentage of circulation, doctor?
1/5.
You thought C, doctor? 5%?
15.
13 to 15%. That is the central government fund to the state government. So 750 ml of blood will come, doctor, to brain. Not full 1 liter also. When the CNS sends a weak signal, why the smaller motor units get excited first? What is your wrong answer, Nafis?
B.
You thought B. Smaller motor neurons are more in number. No. Even if they are more in number, why should they be the ones to get excited first?
Yes.
More in number doesn't conquer a property of exciting first unless they are more excitable than larger motor neurons.
A.
That's right. Young children are having more enthusiasm than old geriatric professor and HOD. First year MBBS student just passed from the CBSE, and you see anybody topper in medical entrance, what he will tell when he joining MBBS, what do you want to do? TV will ask, I want to discover Nobel Prize to save entire humanity. Utta level enthusiasm rahta. Ultimately, when you finish housemanship, if you ask a question, what do you want to do? If I can survive this entrance with qualifying mark, my marriage is stagnated. I am waiting that girl for having death in coitus. So he will be waiting for that opportunity of a matrimonial proposal which got blocked because of a stupid PG entrance. The Nobel laureate guy. So our enthusiasm dwindles down. So smaller units are more excitable than the larger motor neurons is what you need to remember. Now doctor, what is the function of Golgi tendon organ and muscle spindle? You need to have clarity. What was your answer, doctor?
D.
Very good. Muscle spindle, not Golgi tendon organ. Muscle spindle. If you look at the cross section of the muscle spindle, you have got the extrafusal, interfusal, 1A afferents and gamma motor neurons, alpha motor neurons, etc., etc. So the stretch on the muscle is the one which is basically detected by the muscle spindle, is what you need to be very clear. Dorsal column medial lemniscal system, the touch, vibration, everything are carried by our proprioception is carried by the dorsal column system. What is the speciality of it, doctor?
B.
B, sir. Gradation.
D, poor spatial. B, very good. How much your larger toe is having pressure, how much more or less than your sole? The pressure gradient is all about our feeling the ground, no doctor, or feeling anything for that matter. So it is the dorsal column medial lemniscal system which has that accurate gradation of intensity generation ability is what need to be basically remembered. So it can recognize up to 100 gradations of different levels of pressure, right? When you lie down on a soft pillow on the bed, you know it is soft, but it is more softer or less softer because of our lemniscal system. Which carbohydrate do you see in glycoproteins, doctor? Give an answer.
NS2.
So I am very happy to see Vijayawada also online. Please find out from Gulbarga, Suhail, whether the voice is loud and clear and the broadcast is without any buffering. If you have 1 Mbps line, even sitting in a small village, you can be able to access the program, doctor. What is your answer?
N-acetyl neuraminic acid.
N-acetyl neuraminic acid, sialic acid is the one which need to be basically remembered, which is a important component. What was your answer, doctor?
C.
Good. Then allosterically regulation of glycolysis.
C.
Excellent. Glycolysis, gluconeogenesis, glycogen synthesis and breakdown, fatty acids, purine pyrimidine metabolism. Totally 10 cycles, doctor. Every week my job is to remind you, to read, review, remember and forget it after entrance is over. So that is the important rule. So hexokinase is influenced by glucose 6-phosphate levels. Phosphofructokinase is by fructose 2,6 biphosphate, AMP, ADP and also by ATP and citrate. Some inhibit, some stimulate. Similarly, pyruvate kinase is by fructose 1,6 biphosphate and ATP and acetyl-CoA. Whenever glycolysis के बारे में examiner पूछे तो only these issues are asked, doctor. I gave it all in the literature given to you. What are the activators, inhibitors of the glycolytic intermediates? Is one of the favorite question of the examiner. Fig glue, formiminoglutamate acid. Where is it? Which amino acid metabolism is it involved?
I wrote D, sir.
You don't know? You wrote D, thymine.
I got confused.
Thymine you thought. Folic acid is Asha's answer. Any other, at least now you answer other way. You thought pantothenic acid is acetyl-CoA.
Thiamine, sir.
Thiamine is your proposal from Ramakrishna. See doctor, which amino acid metabolism mein fig glue is an intermediate? If anybody tells, gets a gold medal.
Histidine.
Superb. I told you Ramakrishna is sonorous. That's right. Histidine, N-formimino-glutamate it will form. From that glutamate gets produced. Tetrahydrofolate is the one which receives this formimino group. Raju, is the Gulbarga transmission okay? What is that? Net speed issues are there. Okay. Formimino tetrahydrofolate. So, fig glue is very important component which is formed in the histidine metabolism. If at all there is any folate deficiency, tetrahydrofolate cannot form. If it is not there, what will happen? The formimino fig glue become accumulated. That's what you need to basically remember, doctor. There is a markedly distended abdomen due to hepatomegaly, hypoglycemia, hyperlipidemia, hyperuricemia. What comes to your mind?
Von Gates.
Von Gates disease. Similarly, Lesch-Calihan syndrome, HGPRT deficiency. Where comes the HGPRT? Everything you must iron out, doctor. Pyruvate carboxylase, what are the important controllers of it? Allosteric controllers. What is your otherwise possible answer?
AMP.
You thought AMP.
Acetyl-CoA.
Acetyl-CoA. So, doctor, there are two options which are available. Either to walk towards gluconeogenesis or to walk towards glycolysis. Either of the two, whenever we have abundance, what we will do? Do we walk towards glycolysis or do you walk towards gluconeogenesis?
Glycolysis.
You want to break the glucose or you want to store the glucose?
Gluconeogenesis.
So you try to store
the glucose.
Store the glucose when you have abundance. When you have deficiency, you try to break the glucose. Accordingly, what happens to the, how the fructose 1,6 bisphosphate is it inhibited or stimulated depends upon are you in a fed state or a starved state. So, it is activated by ADP 1,6 bisphosphate whereas inhibited by fructose 2,6 biphosphate and AMP is what you need to remember. Similarly, pyruvate carboxylase. Pyruvate carboxylase is activated by acetyl-CoA. Suppose you are fasting. What will happen during fasting? All our fat get broken. In fasting, you don't have insulin, doctor. Insulin levels will be low. When you are in a fed state, insulin levels are high. Insulin is a lipogenic hormone. Insulin deficiency promotes lipolysis. So, lipolysis, what will lipolysis will do? It will break down the fatty acids. Beta oxidation it will promote and that will release the acetyl-CoA. So when you are fasting, lipolysis will be favored because of the low insulin levels in fasting, which will cause the release of acetyl-CoA, which in turn so much acetyl-CoA that the citric acid cycle can't use it anymore. So that acetyl-CoA will accumulate, and that leads to the activation of the pyruvate carboxylase is what you have to ultimately remember. Now doctor, IgE, what is accept about it?
D sir.
Huh?
D.
Excellent.
Because of
So
M only fixes.
M is the one which is
Most
pentavalent.
M.
M.
So it is the one which is capable of fixing the complement. Cube agglutination test,
Vidal.
one of the type
Vidal.
of tests.
Vidal test.
Vidal.
Vidal. Even a school going kid can answer this. Who participates in hypersensitivity reaction? Which hypersensitivity में complement is seen? Type 2. Type 2 and type 3 दोनों में complement होगा. Type 2 में क्या होगा? Antibody is directed against an antigen which is fixed in the tissues. Fixed in the tissues. Whereas type 3 में antigen is free floating, antibody free floating, both of them mate and then deposit somewhere. So that is what happens.
Sir, if two options are there,
Huh?
if two options are there, 2 and 3.
They won't give two options.
Okay, thank you.
Then they will give you 2 marks. So interleukin. Which interleukin?
2.
2. Very good. Aldesleukin is used in the treatment of skin melanomas and kidney cancer, is what you have to ultimately remember. Which is a non-lactose and a lactose fermenting in the Enterobacter C? Is a favorite question, doctor. So which is a lactose fermenting organism? Classical. You answered wrong. You need to
E. coli.
be doubly sure on Enterobacter C.
E. coli.
E. coli. Other than that,
Then that
Pseudomonas.
Salmonella.
Proteus, Shigella, Pseudomonas, all these 3 are examples of the non-lactose fermenting on the McConkey's agar is what you have to basically remember. Which is oxidase negative bacteria?
E. coli.
Classically is E. coli, which you need to understand. One rule of thumb, if nothing strikes to mind, you answered E. coli, Klebsiella, जरूर वो right होगा. Murphy's law, but not always. Don't accuse me if something goes wrong. Highly bound to albumin.
Small vd. C.
What will happen? Small volume of distribution. A married guy has little chance of dating anybody or everybody. So his volume of distribution is lesser because he got married to a protein bound wife. So have a small VD. Have a small VD is what you have to basically remember. Now doctor, a subject in whom the renal clearance of the inulin is 120 ml per minute. Clearance is about 18 ml. If the drug is 40% protein bound, how much it got reabsorbed from renal tubule? You have to close eyes and think what happens to any substance for it to appear from blood into urine. If you have that imagination, what happens, you will answer this. Simple, doctor. Any substance, certain proportion of it is protein bound. The protein bound fraction of any drug or any substance cannot filter across glomerulus. It remains in plasma. Remaining part filters. Whatever that got filtered has 2 options. Either it get reabsorbed or some part of it is lost into urine. If you know this, you can answer this. Clearance of any substance is the filtration fraction of it into the glomerular filtration rate. Filtration fraction, suppose if a drug is 40% protein bound, 60% get filtered. So here How do you know glomerular filtration rate is 120 ml per minute? Because the inulin clearance is a reflection of GFR. So 120 ml into 60% is 72 ml per minute is theoretical clearance of the drug. But what happened? That means it should appear in urine. Only 18 ml got appeared in urine. A beach में 72 ml और the central government released 72 millions. Ultimately, poor farmer got only 18 million. Where is the remaining percent gone? Without reaching Aam Aadmi is a question. So 72 minus 18 is 54 ml per minute. Is considered to be that reabsorbed drug is what need to be remembered. After 6 hours after giving IV administration of a bolus dose, the plasma level is 5 mg. If the volume of distribution is 10 liters and elimination life is 3 hours, how much dose was administered?
200 mg.
Excellent. So, how many half-lives?
2
half-lives. If you go back, 5 was 10, 10 was 20. So 20 ml, 20 milligram per liter in first MBBS, ultimately in final MBBS became 5 mg per ml. So that's the point. Alpha 1 agonists, Doctor, autonomic nervous system, pharmacology and physiology. So you have to be sharp. Alpha 1 stimulates vessels, vasoconstriction. Alpha 2, where is it located? Brain. Any stimulation of that will cause decreased sympathetic outflow, and that's the reason it is antihypertensive in nature. Beta 1 is there in the heart. Its stimulation lead to tachycardia. Beta 2 is in the smooth muscle. Its stimulation lead to bronchodilation and smooth muscle relaxation. So beta 2 stimulation lead to vascular relaxation. Alpha 1 stimulation lead to vasoconstriction. अगर vasoconstriction हो गए तो what is the response? We develop high BP. High BP tells the carotids high BP है बोल के. Then carotids will stimulate vagus, and that vagus will lead to reflex bradycardia. How can you stop that reflex bradycardia? By antagonizing the vagus. Vagus is parasympathomimetic, acetylcholine releasing. So atropine is considered to be the antagonist to take care of the reflex bradycardia, is what you need to ultimately remember, doctor. Now, mydriasis होना मगर accommodation effect नहीं होना.
Phenylephrine.
What are the two types of drugs which can cause mydriasis, doctor? Either alpha 1 agonists, उनका stimulation should cause mydriasis, or
beta
antagonizing the cholinergic state, atropine, should cause mydriasis. But cholinergic supply is also there for our ciliary muscles, which are important for accommodation. If you paralyze acetylcholine, ciliary muscle also get affected. So accommodation also get affected. But if you produce mydriasis by stimulating alpha 1 agonist, which is sympathetic system, it has no influence on ciliary muscles. So we use phenylephrine. So how do you treat SVT, doctor, if adenosine is not?
Diltiazem.
No, it is prophylaxis.
Diltiazem.
Anybody gave innocent answer as adenosine? Oh, not prophylactically. Prophylactically we don't give adrenaline. Prophylactically we don't give what you call lignocaine. There is no prophylactic role. Now, doctor, predominant tubulo-interstitial involvement.
जागरण.
अगर एक tubulo-interstitial है तो दूसरा क्या होता? Glomerular involvement रहता. So you must know which connective tissue disorders have a glomerular involvement and which will affect tubulo-interstitial system in the kidney when they affect the kidney. What is your answer, doctor?
Jograns.
Whereas SLE, lupus, typically will cause proliferative or membranous changes with interstitial involvement, and is what need to be appreciated. Now, doctor.
Barrett. Barter's.
Barter. Right? So, what is Liddle syndrome? What is Barter syndrome? Liddle's is, which is similar to giving loop diuretics. Barter is similar to loop diuretics. How will loop diuretics function? Sodium, potassium, 2-chloride channel is there, no? In the ascending limb of loop of Henle. They go and block it.
Yes.
Because of that, there is a caliuresis. So, Barter is same as giving a loop diuretic. Simple rule. Right? What is Liddle syndrome? Liddle syndrome is same like Kahn syndrome, which is primary hyperaldosteronism. If you have aldosterone, what will it do? It will activate the sodium chloride channel. So, it will cause sodium reabsorption. In Liddle, what happens? Even though there is no aldosterone, the sodium channel got constitutively activated congenitally. So, it keep on reabsorbing the salt. As such, there is a high aldosterone. Actually, there is no high aldosterone. In spite of that, there is a constitutive activation of the sodium reabsorption mechanism. So, that causes high sodium hypertension. Got it? In Liddle. Whereas in case of the Barter, it is like loop diuretic. So, normotension, hypokalemia, metabolic alkalosis, they are all the features of the Barter syndrome. If you remember these two, you will remember forever. Like hyperaldosteronism is the Liddle's, like the loop diuretic is the Barter. That's all. Now, doctor. The extent of the liver damage, how will you be able to identify?
Liver biopsy.
That is a Supreme Court judgment about it. What a stupid question. There can't be any other answers. Clostridium, how do you know the pseudomembranous colitis, doctor?
Pseudomembrane.
Basically, it is the sigmoidoscopy, which is the gold standard in the investigation. Then,
HCV.
how many answered HBV? Anybody? Anybody? Nobody? Oh, you're all good then. HCV is the one. If you look at hepatitis C, doctor, 50 to 70% people will go into chronic hepatitis. Out of them, 80 to 90% will typically develop chronic infection. Then HBV will progress in less than 10% of cases into chronicity. At least a good news about hepatitis B. Hepatitis B. Now, doctor.
Yes.
What is a syndrome where there is an anosmia with hypogonadism?
Kallman's.
It is basically Kallman's syndrome.
Answer A.
So, low testosterone
But normal response.
and a normal
response.
LHRH response is what you typically. Basically, Kallman is hypothalamic dysfunction. Hypothalamus produces LHRH. LHRH stimulates LH. LH stimulates testosterone production by the gonads. LHRH nahi hai, LH nahi hai, testosterone nahi hai, and that led to hypogonadism. So, low testosterone and a normal LHRH response. If you give LHRH, pituitary is ready to receive. Because hypothalamus is not producing LHRH, problem is there in Kallman. Okay. Now, starvation may what will be the gallbladder situation?
Swollen.
Swollen, because normally cholecystokinin is produced whenever we eat food. If we don't eat, it is not produced. If it is not produced, there is no motility of gallbladder, and that lead to gallbladder distension. Now, doctor.
18 years.
MTP Act is 18 years. Then plant penicillin
Ending.
is a name for
Endrin.
endrin. Very good. Acrodynia, mercury. Hyperpigmentation, palm soles, classical of arsenic. Cognitive domain, how can you best achieve?
Role play.
Role play.
Role player, not lecture.
Role play, sir.
We'll come back on this. Huh? I thought lecture, but anyway, we'll recheck that. I was also not fully convinced. Multi-purpose health worker scheme is who introduced? Huh?
Kartar Singh.
Kartar Singh.
Kartar Singh committee. That's good. How much water do you need? How many Bisleri bottles?
180.
180 liters.
180 liters. You thought drinking water? Eh?
Not drinking water.
No, daily water requirement. खाने के लिए, पीने के लिए, नहाने के लिए, घर के पूरा काम करने के लिए, 4 members are there means 720 liters water tank should be there on the top. Okay. Acha, you thought 5 liters, huh? Oh, I know. You thought drinking water. So that is called SPM. Special masala medicine. Now, permissible level of fluoride is how much, doctor? What is the lucky number? Ramakrishna is not committing. Jaldi bolo bete. Wrong answer bolo aapka.
0.5 to 0.8.
0.5 to 0.8 is wrong. 0.1 to 0.2. Bell bottom pant ka points change ho gaya, doctor.
Sir, permissible.
Normal standard distribution curve.
Yeah.
You think 0.1 to 0.2, you also? 0.8 only, no? You thought like that. We gave like that, no? We gave it as 0.1 to 0.2. Okay, we'll recheck. I did not.
Permissible 1 to 2, sir, actual, not 0.1 to 2.
I mean, already we are in a puerperal psychosis. You are adding a little more confusion. Okay, normal standard distribution, what is your answer?
Yes, sir. Wrong option.
That is 68.27%. Right skewed deviation, left skewed. What is the difference, doctor?
Yeah.
So median is smaller than mean. Then qualitative data which is except scatter. That's right, scatter diagram. Which method will you use here?
Median.
Why not?
Extremes
Why
of
not
values.
mean?
Extremes of values are there.
Extremes of values are there. One is getting only 50 marks, other is getting 5,000 marks. Then what type of error?
A.
Rama has asked Sita to go to Aranya. She did no mistake, but Rama accused her that she has done a mistake. So when there is no real difference, but you ascribe a difference, what is that called? Rama's error, which is type 1 error, is what you have to basically remember. Then direct standardization, why do you want to do? Because in one city and other city, age distribution will be different. So, this is a beautiful question.
0.1 to 5.
Your patients will come and ask you a question. Boy or girl, will you tell doctor? So, what is your answer?
Yeah.
0.125. Why 0.125?
0.5
That's right. But why you did 0.5 into 0.5 into 0.5 instead of 0.5 plus 0.5 plus 0.5?
That is
Not plus,
not dependent variables.
Non-exclusive, exclusive is the way we divide events into.
Exclusive.
It can be boy, it can be girl, it can't be in the middle of boy and girl. So for such events, what will you do? You multiply individual probabilities. Right? So if I ask you a question, will you get seat or will you get married?
Seat.
You can get a seat and get married.
Third option.
You can get married even without getting seat. You can get a seat, still don't get a right boy or a girl. So they are what? Non-exclusive events. In such case, if probability of your getting seat is 0.5, if your probability of your getting married is 0.5, the joint probability is 0.5 plus 0.5 rather than 0.5 into 0.5. That's the point. According to central birth registration, death should be registered within
21 days, sir.
21, not 7.
Birth or death, both 21 days. Recently changed.
This also has a small
Answer is
verification
not there.
required. Will maybe the error in the key. Yeah. Persistent coarse crepitations. How many answered pulmonary edema? Persistent is the word. Actually, coarse crepitations is the feature of both pulmonary edema and also bronchiectasis. But the word persistent makes it more likely to be bronchiectasis. In pneumonia, due to mycoplasma, what is not a feature? Legionella versus mycoplasma. So, mycoplasma में dry cough, pleuritic chest pain, bilateral infiltration वो सब हो सकता. Myalgia less likely. Then this is a beautiful question, doctor. pH is 7.2.
Yes, sir.
A.
A.
You're all sure?
Yes.
Okay. At least let us have a clear word about what is the funda of discovering a compensated respiratory acidosis. What is the rule number 1 for acute respiratory acidosis? If it is acute respiratory acidosis, that is without compensation. Respiratory acidosis कब होता है doctor? Simple. If you hyperventilate, you get alkalosis. If you can't ventilate, you get respiratory acidosis. If you can't ventilate, what will happen? Carbon dioxide become accumulated in your body. Right? So, the bicarbonate will increase by about 1 millimole for every 10 millimole elevation of the PCO2 above 40. Normally, upper limit of PCO2 is 40. Lower limit of PO2 is, remember, 60. Normal value is 80 to 90 is the PO2 at ambient room air. अगर वो 80 to 90 वाला PO2 60 आ गया तो हाइपोक्सिया कहते. अगर PCO2 which is between 25 to 35 rises above 40, you call it as hypercarbia, right? So above 40, for every 10 millimeters mercury rise of PCO2 in respiratory acidosis, only 1 millimeter per mole if it rises bicarbonate, then you call it as without any compensation only pure respiratory acidosis. Got it ना? यहाँ देखेंगे ये 40 से ज्यादा कितना है? 20 में कितने 10 mmg है? 2. So how much do you expect bicarbonate to rise? 1 millimole if there is no compensation. So you expect it to rise around 2. Right? 2, what is the normal value of bicarbonate? That also you should know. 24. So you expect it to be 26. But in this case, it has risen to 36. That is only possible if there is any renal compensation. How will kidney compensate a state of acidosis caused by lungs? Acidosis can be compensated by reabsorbing bicarbonate. That's how kidney compensates the respiratory acidosis. So what will happen to bicarbonate? Instead of rising only 1 millimole, because of this kidney retained bicarbonate, it rises more than 1 millimole. Right? How much more it will rise? It will rise by about 4 millimoles. 1 millimole, normally only bicarbonate will rise in respiratory acidosis. If it rises more than 4 millimoles, then you call it as respiratory acidosis which had a renal compensation. So here how much you expect, doctor? PCO2 raised how much? 20 millimeters mercury. That means you are expecting 2 4 8 millimoles rise above 24. यहाँ कितना हो गया? 24 plus 8 means 32. In fact 36 it raised. That means definitely there is a renal compensation. Okay na? So this is what you attended Dr. Murali Bharadwaj and could not answer acid based disturbances means on moral grounds मुझे इस्तीफा देना है from the teachership. So be very sure there are renal tubular acidosis, anion gap, acid based disturbances, तलवार के तार के जैसे you should answer without doing any mistakes. FEV1 by FVC reduced in
Asthma.
obstructive pathology like asthma. Most common cause of empyema?
Bacterial.
Bacterial pneumonia. Beautiful. Mediastinitis commonly is due to
Esophageal rupture.
excellent esophageal rupture because you are instrumenting the esophagus. Clubbing is not a feature of
Small cell cancer.
Small cell
why? Because small cell carcinoma will disseminate rapidly. No time for producing clubbing and then killing a person. Before that only adrenal everywhere it will metastasize and kill. So you don't have time for development of clubbing. Serum AS
Cancer.
other than sarcoidosis,
Bronchogenic carcinoma.
even silicosis, berylliosis it will rise but not in bronchogenic carcinoma. Cryptogenic alveolar fibrosing alveolitis, what is not a feature?
D.
Huh? D, that's right.
Increased.
So it is not a obstructive lung disease, that's the reason. Absenteeism,
A.
this is the minimum guarantee question. Those who
Sir,
didn't
D.
answer this question,
Sir, what about D, sir? A and D. Oh, right.
hypserhythmia you answered.
Infantile
I
spasms.
answered A only.
That's what. No creative answers for uncreative questions. That is the minimum guarantee you need to give when you go for entrance. You have seen a recent Comet K paper?
Yeah.
2/3 of questions are normal. Mortals can answer. Who prepared for 6 months.
Are repeats of Murli Bharadwaj exam. Are repeats of Murli Bharadwaj exam.
Good number of repeats. Good number of repeats. Then remaining questions may around half of them are remaining 1/3 may. 2/16 will be there, no? 1/2 Bhagwan Venkateshwar ko chhod do. Balaji will take care. Remaining 1/6 aapka common sense. Did you bring only your cauda equina to the exam hall or to the both the brain also you are carrying in the cranium is a deciding factor. There is a time where your heart may, you should not get reflex tachycardia while answering. You should not panic and answer. You should over imagine and answer. No, not agreeable. That is a test of your personality. Type A, type B, everything is tested there. But neither that 1/3 where Balaji ka krupa hona or remaining 1/3 where your common sense is required, they are not the deciding factor. That first 2/3 which simple human beings are supposed to ask, they are not to be, it is very difficult to be simple. So we tend to be complex and we do mistakes in that 2/3. If you survive that stage, then comes the second level of competition, which is your common sense based questions, right? Forget about that 1/3 where God's grace need to be there. God will showing equal grace to everyone. He is not
Partiality.
He is not partial. So, doctor, thrombolytic
A.
acute phase may. Typically tissue plasminogen activator is the one which we use. Lacunar
A.
lipohyalunosis of penetrating arteries.
A.
Right or left, which is dominant in
Left.
right-handed guy, left. Only dominant hemisphere mein speech area will be there. The right-handed guy mein left side infarct hai to then only speech get affected. Transtentorial uncal herniation mein what do you see, doctor?
D, sir.
A.
You thought ipsilateral dilated pupils? That is called as false localizing signs will be there. Oculomotor, the transtentorial herniation will be there, no? It will hold the table and use its leg to push the opposite side oculomotor. That lead to development of contralateral dilated pupil. False localizing sign. So,
Sir, but first it will push on the same side and then opposite side.
no, there is no such progression. There is no such progression. So, it is the decorticate rigidity.
Decerebrate.
No, doctor. Decerebrate means directly if you take a knife and pluck it into the cerebral cortex, you get what? Decerebrate rigidity. I mean, No.
Decorticate.
Decorticate is you are bringing a discontinuation for the cortex to show influence on the spinal cord is decorticate rigidity. When the brainstem level may, if there is an interruption,
Decerebrate.
your cortical influence will not be there, no, on the spinal cord. So the rigidity is due to decortication, interruption of the cortical continuity because the midbrain level interruption.
What is decerebrate, sir, then?
That's what decerebrate rigidity is at the below the level of the brainstem, right at the level of the spinal cord. May, if there is any influence, then that lead to development of a decerebrate rigidity, as what you see in the case of the tetanus, etc., etc., where the problem lies at the level of the spinal cord.
Sir, here Stokes breathing is also given.
What was given?
Stokes breathing.
Stokes respiration is also given. Oh, then C should also be included then in that case. C should also be included. Okay. Inferior frontal gyrus is Broca's or Wernicke's?
Broca's, motor aphasia.
Beautiful. Motor aphasia. Triad of normal pressure,
C.
hydrocephalus.
C. Repeated questions.
Guide disorder, urinary incontinence and dementia. Painless burn hand.
Syringomyelia.
Because of the dilatation of the central canal, there is a compression on the decussating fibers of the spinothalamic tract, which is carrying pain and temperature. So, Syringomyelia. TBM, what is an important finding, doc?
Exudate at the basal cistern.
Exudate at basal cistern is a classical feature which you see in the case of the TBM, is what need to be remembered. Which porphyria cutaneous features are like angioedema?
Erythro.
I told you one question will be on porphyria. What's that? Erythropoietic porphyria classically present similar to angioedema, which is due to C1 estrase deficiency. Familial hypercalcemic hypocalciuria. What is your answer?
C.
Beautiful. It is a mutation in the calcium sensor protein. Normally, the calcium sensor is supposed to regulate how much calcium is going to be reabsorbed. Any abnormality of the calcium sensor will make the kidney to unduly reabsorb the calcium. So all that reabsorbed calcium accumulates in the plasma, hypercalcemia, no calcium appears in urine. So it is called, it is a familial problem genetically. So familial hypercalcemic hypocalciuria. In these people classically their calcium creatinine clearance ratio will be less than 0.01. That's how it differentiates it from the other hypercalcemic states.
Sir, but it should be mentioned, no sir, urine calcium by creat.
Urinary
Calcium by creat.
Since there is no plasma calcium creatinine existent in the practice, it is implied fundamentally. But anyway, we need to add that value. Now, why is this value important? Calcium creatinine clearance. Suppose if a patient has got a hyperparathyroidism. Hyperparathyroidism, he has got hypercalcemia. All that hypercalcemia ultimately will lead to, at one point of time, excess calcium loss into the urine. That is different from familial hypercalcemic hypercalcemia, where calcium in the urine is fundamentally low. So to differentiate one hypercalcemic state from the other, calcium creatinine ratio is an important parameter, is what need to be remembered. What is polyglandular autoimmune syndrome type 1, doctor? Type 1, type 2, you need to be very clear. It is not autosomal dominant, but it is autosomal recessive inheritance. Diabetes, hypothyroidism, ungual hypertrophy, tympanic membrane sclerosis. These are all the important features which you need to basically remember. What is except about chronic hypercalcemia? Shoot an answer, doctor. Huh? Hypermagnesemia is what you thought.
D, sir.
Huh?
Sir,
CRF, hyperparathyroidism. Actually, this should be vitamin D deficiency. Yeah. All this lead to hypomagnesemia except. This is a difficult question to answer. Whoever answered read dyslipidemias very well. Nafiz, आपका आंसर क्या था बेटे?
Barter.
Barter. Barter is typical to loop diuretic. Loop diuretics will lead to caliuresis, magniuresis.
So Gittleman, sir. Gittleman.
Sir,
Gittleman also is associated with hypermagnesemia.
Sir,
Both of them, there is a common thing that they share. Lithium intoxication. Lithium intoxication is known to lead to hypermagnesemia, not hypomagnesemia. You can't help it. List is very long. Somewhere we can pluck some rare, unknown, unexpected cause and then add it. Only reason if you answer this question correctly means, I don't know, you carried brain with common sense and thought. Intoxication is something to do with a hyper state, not with hypo state. But there are a good number of intoxications which can cause hypodyslipidemias. So the heart has the reasons that reason doesn't know. So some questions you need to answer with heart, some with brain. And all the winning and losing the entrance is the brainstem deciding when to use heart, when to use brain. So where you are supposed to answer with heart if you use brain? CSF is never same as pericardial fluid. Now hemochromatosis, what is your answer, doctor? I know you are going to have lot of parliamentary controversy. Yeah.
Arthritis.
Arthritis you thought, no?
First is fatigue, after that arthralgia.
See doctor, all these are found. But percentages are always there in seed sharing, in every domain of life. Of all, it is the hepatomegaly. Hepatomegaly followed by arthritis was given. Check it.
Only thing is arthralgia is
Hepatomegaly is 13%. Arthralgia is not same as arthritis. No, what doctor? Exam going, EGPGs, exam going postgraduates. Ectopic acidic from pituitary macroadenoma. How will you differentiate?
venous sampling. See.
Simple. Go to brain, check how is petrosal venous. If it is from pituitary, it will be high. If it is from ectopic, it won't be high.
Sir, but non-invasive is better, no sir? MRI. Non-invasive is better.
MRI pituitary में क्या पता चलेगा? कभी-कभी pituitary adenoma size may not be visible to you on pituitary. MRI pituitary. In spite of that, it will be causing Cushing's. So MRI pituitary खाली नहीं बोल सकते. So there is a reason selective venous sampling is a superior indicator. Ethanol induced hypoglycemia. Why will it occur? शराब पीने वाले क्यों बीच बीच में hypoglycemic state में जाते?
Gluconeogenesis.
Alcohol is known to block the ability of the liver to do gluconeogenesis, is what need to be basically remembered. I am very happy to see Mamta and the students of Kakinada, everyone aggressively participating in the discussion. So doctor, LDLC goal, if this question straight comes in tomorrow's state MD entrance, you have to, you know my address where to send the sweet packet.
Sir, that is D, sir, less than 100.
There are few provisions doctor. Female reservation quota रहेगा, बहुत कुछ है. Ultimately आपका rank के वजह से सीट नहीं मिलता. देखो, less than 160 for a normal guy. Normal guy बोले तो एक बीबी, दो बच्चे और एक आमदनी वाले आदमी को 160. जिसको दो रिस्क फैक्टर्स है, शराब पीना और धूम्रपान करना, So less than 130. If he also has diabetes and he is also having the CHD or CHD risk equivalents, then coronary heart disease risk equivalents less than 100. You must know the criteria.
Sir, these lines are not there in any book, sir.
It will be there, doctor. If it is not there in any book, it is there in every book.
Less than
Maybe the book which you have not read, possibility one. Second, it may be there in the book but you did not read. See how our brain is working nowadays?
Sir, there will be one column, sir.
No, doctor. Now,
Sorry.
IVD does not correlate. But hyperlipidemia may, if you go wrong, that gives me nightmare, Nafis. This is the time where hyperlipidemia guidelines, everything. You must be ready. Like a April, May, you are going to run in the wards holding the blood in pediatrics, general medicine, here and there. Another 60 days, doctor, you are no more in that non-resident Indian status like MBBS. You are a proper citizen of US ke jaise. MD, for few days we will be thinking, are we in MD? Are we in MD? Is the MD with us? There is only one thing in our life that brings such a feeling, that is when you join MD. Everything else, any attachment of status bring depression. If you are married, you will be thinking, oh I am married, oh I am married. Only first 15 days you will have, wow I am married. If you can say after 20 years also, wow I am married, oh then you are a tiger, roaring tiger. So doctor, few more days, just living the dream. Dream is all that differentiates humans from the lower species of Darwin. Now doctor, IBD will not correlate with inflammatory bowel disease. Psoriasis and IBD does not correlate. Window period, generally when HBS AG disappears, anti-HBS will appear. बहु सांस जी जाने के बाद बहु अंदर आएगा. HBS, anti-HBS are like that. But between the two, when it left and that did not arrive, that's called window period. What is the best one? IgM, anti-HPC. What increased the chance of becoming a carrier?
Pregnant women.
Not the pregnant women, but neonates, Down syndrome, those who are on chronic hemodialysis, they have a greater chance of becoming a HBV carrier. You are worrying, no? Why Downs will become more often HBV carrier? They are all facts. Medicine is a compendium of facts. I came to know yesterday only that Downs have a more chance of becoming a carrier. So, but this is a potential standard question.